want to thank you for being here as we announce this important community-based initiative to address lead poisoning in Cleveland. And as you know, lead poisoning, particularly with kids, is the #1 challenge, not only in Cleveland, but throughout this country. And we've been focused on this in the past for quite a few years. And what we'll continue to do, continue that focus as we move forward, working to find a comprehensive, sustainable, and preventive solution that works for all of Cleveland's families. Now, everything that we've done and that we've been successful at, we've done as a community, no matter what it's been. Everything that we've been successful at, we've done as one community. Now, I will give you some details of some of the things that we've done in the city, but those things just by themselves will be isolated and will have very little impact and incremental effect. But as a community, as you will hear, working together in a comprehensive, sustainable way, we can really have significant impact on the lead problem in this city and really the region. In 2016, I launched a Healthy Home interdepartmental initiative, which includes city departments who have worked hard to eliminate operational silos and collaboratively tackle barriers to address lead poisoning. Many times, not only in government, but in all organizations, we operate in silos, and from organization to organization, we operate in silos. Eliminating those silos are important. In the last 2 years, the Department of Building and Housing has prioritized and revamped the rental registration and lead inspection process. There are 59,000 rental units currently registered and renewed. This process includes randomized lead dust inspection as well as improved landlord outreach. Again, we want to, as we're trying to solve a problem, we're not trying to create another problem in doing so. So we're not only we're attempting to address the issue by identification, but also work with those property owners to ensure that we can assist them in helping to remedy the lead problem. Department of Public Health has also increased staffing levels, began placarding homes to warn the public that a child was poisoned in the particular home, and it is legally uninhabitable until that lead problem has been abated. We have also implemented Excella Citizen Access as a resource for residents to look up lead status and housing code violations. This is us attempting to be transparent and giving citizens opportunities to do research before they make decisions where they will live, particularly around lead and the condition of the property. This is in addition to working with the community and grant-making partners to research best practice and chart a new pathway as Cleveland moves forward. And you'll hear from some of the speakers about many of the things that we're doing to collaborate not only within the city of Cleveland and Cuyahoga County, but also looking at best practices throughout this country. That's where we have been, and today we will hear from many others who can tell us where we'll be going and how we plan to get there together. That's a basic outline of what this is about. I'll ask the Council President Kelly, to come up, and then he will introduce, after he speaks, he'll introduce the next speaker.
Thank you, Mayor. Oh, sorry. 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 Okay. As the Mayor stated, there have been a large number of people in this community that have been working collectively to address lead poisoning for a long time. But addressing lead poisoning in a way that is comprehensive and sustainable and preventative will not happen overnight. We, as a country, we know more about lead poisoning than we do many environmental health issues. And there are solutions that are out there. And that's what we've learned as we've come together to study this issue for many months and years. So now our challenge, the challenge that's before this community, is we need to take what we know and turn that into what we can do. And this can be done, and we've already started. City leaders, county leaders, the philanthropic community, the nonprofit stakeholders, the healthcare community have been engaged in a series of learning exchanges. We, as an emerging coalition, we attended the HUD Healthy Homes Conference. We went on peer-to-peer site visits in Rochester, New York, and we've had in-depth discussions with national leaders on lead poisoning, including Rebecca Morley of the Robert Wood Johnson Foundation, David Jacobs of the National Center for Healthy Housing, and other leaders from Omaha, Greensboro, Los Angeles, Buffalo, and Kansas City. In our travels to Rochester, we saw a community that came together and reduced lead poisoning by 85% in 10 years. With all the communities that we talk to, we ask questions like, what works for you and what can we replicate in Cleveland? And while no one solution fits, we learned that legislation alone will not fix this problem. Putting more money into bureaucracies is not going to cure this problem. We have to be invested in crafting a solution that is going to work for Cleveland. There is no one-size-fits-all solution. Every community is different, and Cleveland is going to continue to study this and adopt best practices and ultimately develop our own system, our own solution to this problem. And that's what has brought us here today. And if we look at the coalition that has emerged to come together to fight this awful issue that's affecting our children, we've really looked at what have we done in the past and what do we need to do differently. Now, historically, most of our responses to lead have been reactive. We would be notified that a child has been poisoned, and then we would go into action. There wasn't a preventive component to it. And if you look at what the state and federal government provides as remedies, a lot of it is full abatement and full removal of lead. The problem with that approach is that in the city of Cleveland, it is not cost effective. We can't get to where we need to be if we are at a lead-free standard. But we can create and we can work towards a lead-safe Cleveland. And there are solutions towards a lead-safe Cleveland that will ensure that homes aren't necessarily free of lead, but safe through interim controls, safety measures, and painting maintenance is what will really is cost effective, and it is effective in solving the lead issue. But again, there isn't a silver bullet. There isn't one thing that we can say we're going to do this and that will change it. It's going to be a comprehensive approach that's going to involve all the community leaders that you hear today. It's going to take all the commitment. It's going to take everything that we as a community can do coming together, focusing on this issue to come up with a comprehensive, sustainable, and preventative plan that creates a lead-safe Cleveland. I am sure we can get there. If we all come together, there is nothing that we can't do, and there's enough commitment in this room, there's enough commitment on this stage to basically send the message that this is something that your city takes very seriously, your community, and we will solve this together. Our next speaker, Mitch Balk from Mount Sinai Foundation, will tell us a little bit about what they're up to, but I just want to just take a moment to really there's been a lot of very involved people, but Mount Sinai has been just a champion for this issue and just really worked forward. They were with us when we launched First Year Cleveland to address infant mortality and understand how we bring communities together to solve problems. So, Mitch, thank you.
Thank you, Council President Kelly. Good morning, everyone. I am Mitch Balk, as you have heard, President of the Mount Sinai Healthcare Foundation. I'm here today representing private sector funders who have been working quietly but intensively for the last 10 months alongside City of Cleveland leaders in public-private partnership to address lead poisoning. Our goal has been to create an evidence-based model that will operate at scale, that will be embedded into our community, and will be sustainable into the future. Our work to date has been fruitful, to the point that we are today ready to announce the establishment of the Lead Safe Cleveland Coalition and to unveil our initial strategic approach that will result in a significant reduction in the number of Cleveland's children with lead in their bloodstreams. In March of 2018, Mount Sinai convened grant-making colleagues to present the results of a listening tour that interviewed dozens of community stakeholders and to study lessons learned from previous efforts. This group, which we now call the Funders Concerned About Lead Poisoning, includes Mount Sinai, the George Gunn Foundation, the St. Luke's Foundation, the Cleveland Foundation, the Bruning Foundation, the Sisters of Charity Foundation, the Third Federal Foundation, and United Way of Greater Cleveland. Most of you are represented today. I'd ask you to stand, but I think they're already standing behind me. And also joining us today, some sitting in the rows ahead of me and some standing behind me, are other coalition partners from housing to healthcare to economic development from both the public and private sectors. And thank you each for standing shoulder to shoulder with us today and into the future. In partnership with the City of Cleveland, here is what this quiet phase of our emerging coalition has been able to accomplish to date. Number one, we have commissioned research. Cleveland's lead-safe solution must be research-based and reflect Cleveland's unique assets. So, in addition to the learning from national experts and peer cities, the coalition has funded 3 research projects at Case Western Reserve University's Poverty Center, including a comprehensive scan of lead poisoning interventions and their effectiveness, B, an in-depth profile of Cleveland's landlords and their properties, and C, an upstream analysis of the long-term costs of lead poisoning to our community. Secondly, we are working with Environmental Health Watch to build on their work of engaging with community residents, homeowners, families, parents, and teachers who need to understand the risks of lead and to protect children against exposure. The launch of a marketing campaign and a website, public information, and more can help make sure that this happens. Our aim is to reduce lead exposure in both rental properties and owner-occupied homes. Third, we are looking to housing experts, enterprise community partners to provide technical assistance around policy development, convening, and exploration of what you'll hear is going to be called the Lead Safe Home Fund. Finally, you've already heard actually about our study trips that we took to the U.S. Department of Housing and Urban Development Healthy Homes Conference and the Rochester trip, where 30 Clevelanders went to school on how that city has achieved remarkable success. Lead Safe Cleveland is rolling up its sleeves, ready to get the job done. Leading the way will be the coalition's initial standing committees, 5 of them, chaired by experienced, passionate leadership in our community. The Policy Committee, to be led by Enterprise Community Partners. The Community Engagement Committee, to be led by Environmental Health Watch. The Resources Development Committee, to be led by the George Gunn Foundation. The Cleveland Lead Safe Summit Planning Committee, to be led by United Way of Greater Cleveland, and the Governance Committee, to be led by the Mount Sinai Foundation. I should also mention that our emerging coalition is a founder of the National Funders Action Network on Lead Poisoning Prevention, co-convened by Mount Sinai Vice President Daniel Cohen, and with partners that are national funders, including the Pew Charitable Trust and the Robert Wood Johnson Foundation, the nation's largest health philanthropy. We hope to ensure that Cleveland figures very prominently in these emerging national discussions. I will close by reflecting what Council President Kelly had to say, that it turns out ridding Cleveland of its lead and reducing lead poisoning are not one and the same. Our strategic approach recognizes that while removing all lead from Cleveland is likely an insurmountable task, reducing lead poisoning is something that we can achieve if we are willing to work together in partnership. We can reduce lead poisoning by 85%, like Rochester did over 10 years, by adopting and enforcing policies focused on low-cost interventions, these interim controls, and ensuring that systems of accountability are in place to scale and to maintain progress. One of these systems of accountability is already in place, the public-private partnership that we launched today. Lead poisoning is a public health problem with a housing solution. As the mayor said to us earlier, we can get this done. We must get this done for Cleveland's children today and for generations of Clevelanders yet unborn. Thank you, and it's my pleasure now to introduce Cleveland City Councilman Blaine Griffin, Chair of the City Council Health and Human Services Committee.
Thank you, Mitch. For those of us that are Hamilton fans, I want to say that at this moment, history has its eyes on us, and it's our shot to try to get it right. So it's my duty to talk about the plan of action that we plan on doing in order to try to reduce lead exposure in our community. Number one, as the mayor said, anything that we do that we've been successful at, we establish as a community. You see by the broad support that you see here today, that we're here to establish a community goal, not one sector or one silo, but a community goal that involves every sector of our community to be successful. Number two, what we will do is we'll realign our lead legislation that we have right now, which is 240, which guides our lead policies in the city of Cleveland, with significant input from internal partners like the Building and Housing Department, as well as the Health Department, Community Development, as well as external partners, that we really want to be inclusive as we put this coalition together. I see a lot of other people that have been active on the ground working on issues around lead on a regular basis. We know this legislation needs some change, and as we craft updated modern legislation, we won't be introducing something for the sake of introduction. Our approach will be comprehensive, sustainable, and preventative, and our policies will be enforceable yet affordable. To those Clevelanders struggling with housing insecurity, I want to assure you that this legislation will meet you where you are at, not create red tape and bureaucracy that contributes to the instability. And to our community's landlords, let's be clear, we're going to have an iron fist but a velvet glove. I want you to know that we will hold you accountable for the quality of the units you own. But we will also help you access the resources you need to do the right thing. And to the taxpayers, I want to assure you that any investments we make will pay dividends for our education, justice, and healthcare systems. If we make Cleveland lead safe, we all benefit. Last but not least, to the children of Cleveland, I would tell you that legislation is only the first step. This coalition is committed to creating new policies and to so much more to address this issue once and for all. There will be no half measures with our legislation. That's why our team have been working hard over the past several months to explore a comprehensive legislative package that covers 4 key areas: prevention, screening, treatments and interventions, and education and outreach. Number 3, we will hold the Cleveland Lead Safe Summit. One of the first orders of business for the coalition is organizing a Cleveland Lead Safe Summit. This will be an opportunity to learn more from experts in peer cities, but more importantly, it will provide an opportunity for Cleveland's community to convene and work a lead-safe solution together. We will welcome national experts, landlords, the media, advocates, community members, elected officials, and many more to participate. I know a lot of people ask, another summit. Well, you know what? We're going to keep doing it until we get it right. We'll create a public forum to elevate resident stories like Ms. Brown, who's here today from the community in Seacoast, to better understand the challenges landlords and address tenant rights and workforce development, which we also believe is a critical component of this, just to name a few possibilities. It will also be an opportunity for every organization in our community to commit together to address lead poisoning. And I want to say this. This is an inclusive process. We will invite anybody to the table who genuinely cares about our kids in this community. This is not a process that we will allow to become adversarial. This is a process that if you care about the children of Cleveland, then you're a part of this coalition. We will create a Lead Safe Home Fund. The Lead Safe solution the Council President referred to will result in improving our community's housing stock. To make it happen, the coalition will model a Lead Safe Home Fund and explore its capitalization. We will leave no funding source unexplored to create the fund. We're going to have the tough conversations with all sectors about how we support this work. Some even more non-traditional allies that have said they want to come to the table to be part of the solution. We're going to use the resources that may be limited, but we firmly believe that a Lead Safe Home Fund could thrive through a public-private partnership between the city, philanthropic, and corporate sectors, among others. A Lead Safe Home Fund is an opportunity to work with our landlords, not in opposition to them, to improve homes in Cleveland. We know Cleveland's landlords want to do the right thing, but many of them do not have the resources, money, or knowledge to make their homes lead safe. The Lead Safe Home Fund is an opportunity to assess how we create lead safe homes and, more importantly, maintain it over a period of time. Last but not least, number 5, we will advocate for state and federal support. Our coalition cannot succeed on its own. We've seen what happens in other communities when legislation is pursued without broader support or understanding. Cleveland needs the right resources for the right purpose to get this job done. We are encouraged by incoming Governor DeWine's platform prioritizing childhood initiatives. Our coalition hopes to partner directly with him and his administration. We hope that he sees what we see, that Cleveland is leading the way in Ohio with a comprehensive, sustainable, and preventative approach to addressing lead. At this time, I want to bring up our community partner who has been on the ground working on this issue for several years, Kim Foreman from Environmental Health Watch.
Good afternoon. Environmental Health Watch has a long history advocating for healthy homes, lead poisoning prevention, and asthma prevention for over 35 years. I've had the pleasure of working alongside community partners and learning from residents for over 20 years. The mission of Environmental Health Watch is to create healthy homes and sustainable communities by identifying and removing hazards, engaging people, and advancing equitable environmental solutions. I must acknowledge and give respect to a short list, although not all, of the thought leaders who have informed the nation, initiated the Healthy Homes movement, and paved the way for decades, working tirelessly on preventing lead poisoning and other hazardous housing conditions in homes. Stu Greenberg, the former Director of Environmental Health Watch, Dr. Dor Dearborn, formerly from University Hospitals, Jim LaRue, Green Building Advocate, Bobby Anderson, formerly from the Metro Health Hospital Lead Clinic, both City of Cleveland and Cuyahoga County Health Department leadership, the Healthy Homes Advisory Council leadership team, and members. Over the last 4 years, as part of the Bill Health Challenge, EHW has led and worked successfully with city departments, philanthropy, nonprofits, hospital systems on bold, upstream, local, integrated, and data-driven solutions focused on healthy homes and policy change. Through a collaborative, multi-sector process and partnership. Participating in the Let's Safe Coalition announced today is a natural progression of the accomplishments, teamwork, and dedication to equitable and better public health outcomes for our city. We cannot become sensitized and comfortable with analyzing maps, percentages, data points, figures. We can't continue just discussing racial equity, health disparities, or describing conditions of those who are impacted. Let's be intentional, dedicate the time it takes to build trust and develop authentic partnerships with community, deliver on what we claim is important, and continue to celebrate real action and successes. I believe we can and will work together until we get it done. It takes innovative thinking, long-term commitment, practical strategies, and application grounded in equity, and focus on root causes to make a difference. Systematic and sustainable change is what we are seeking. Community residents and leaders, especially people of color who are most impacted, cannot get left behind. Their participation and voices must be core to this effort and included in co-creating solutions to prevent and reduce the number of lead-poisoned children in the city of Cleveland. These are all of our children, regardless of socioeconomic status, background, race, or the neighborhoods they come from. This is an urgent issue. This is about quality of life. I'm excited to be a part of the developing Lead Safe Coalition, working with committed and dedicated individuals who want to reshape the narrative, creating healthier homes, environments, communities, and most importantly, protecting the children who live in them. I invite you to join us. And we'll have closing remarks from Mayor Jackson.
Well, as you can see, there are many organizations who've been doing a lot of work for a long time to address this particular issue. The problem is that as successful as each of those organizations has been and can demonstrate, it has not been as impactful as it could have been if we would have had a better coordination, collaboration. Sustainable, systemic change is what is needed, and we're at that point, and I believe that we'll get it done. So are there any questions? Questions. Yes, sir. Why now? Everything is in, why does things happen when they happen? Like I say, many of these organizations have been working in the vineyard for whether they've been advocates, whether they've been in the public sector, the philanthropic sector, hospitals, health professionals. We've all been doing it to some degree, and we've all can demonstrate some success, but we are unable to demonstrate a true sustainable systemic change that we need to make by creating an infrastructure. And it just happened that is now. It should have happened 10 years ago? Probably so. 50 years ago? Probably so. Should it have happened when we found out in 1970 something about lead in paint? Probably so. Should it have happened when we had lead smelting in Cleveland and we found that it was hazardous to the health of people, and people worked in those companies would have it on their feet, walk home, get the dust. Children when we found that out, should we have done it then? Yes. So now here we are.
Mr. Mayor, when will you be able to discern what success looks like?
Say again.
When will you be able to discern what success looks like?
Well, you have to have a baseline, and I believe that all of what we're doing in terms with all the organizations and all the information they have and the data that they've collected, we can put together a pretty good baseline as to where Cleveland, the county, is right now. Then, as all the speakers have indicated, and the group has committed to putting together a strategic plan to identify where we want to be in a certain period of time, then we'll identify what steps we will take to get there. And you always put measurements on that. I cannot tell you what that is right now unless there's one of the speakers who can identify that.
Thank you, Mayor. I don't have the exact measure of what it'll be, but to me, what we're doing here, we will know that we're successful when there's less children poisoned, and we will get those numbers.
That's the ultimate goal, process of getting from here to there, and creating an infrastructure that is sustainable beyond. It doesn't matter who the mayor is or who the council president or environmental health watch, who's the advocate, or who's running which hospital or which foundation, is putting together the infrastructure that is sustainable, that will outlive the personalities involved. That's the key. Anybody else? Well, we have where the Latoya. What's next? Huh? That's it. Thank you very much. All right. Thank you. Thank you.